have a quorum. Let's all stand for the Pledge of Allegiance to the flag. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Are there any corrections to the minutes of the previous meeting? If not, we need a motion to approve the minutes from the meeting of June 3rd. Moved by Commissioner Kopendorfer. We need a second. Seconded by Commissioner Powell. All in favor signify by saying aye.
Aye.
Opposed?
No.
No. Motion is carried, 5 ayes and 1 nay. Next is approval of the agenda. I would like to remove item 2 from the agenda. Health and Human Services, Health Division, establishment of a nurse practitioner classification. The HR department found a current classification today that will be sufficient for our needs. I would also like to add in place of that resolution to provide emergency contraception through the health department, a policy to provide emergency contraception. Are there any additional changes or corrections? Yes.
Thank you, Madam Chair. Can I ask that that be number 1 due to time constraints for everybody else?
You could be number 1.
Okay. Thank you.
We need a motion to approve the agenda as amended, approved by Commissioner Gershenson.
Discussion
Yes.
on the motion?
Second by Commissioner Copeland.
No, I don't want a second. I'll let somebody, I'll let somebody else
I'll
second,
second.
and then we can have discussion.
Second
How's
by
that, sir?
Commissioner Nelson. All in favor? signify by
Discussion on the motion?
Oh, yes.
Just a quick question. I'd just like to know why this wasn't on the agenda prior to this.
Okay,
I'll defer to Commissioner Gershenson.
my apologies. This was on a previous agenda, and after discussion with Kathy Forsley, we decided to postpone it to this meeting. However, staff wasn't properly informed, and I take full responsibility for that. But now we have Kathy Forsley and Deb Bridson from Honor Health here to discuss, so.
And I understand oversights happen. I'll be voting no, though, only because I would have liked prior notice and the
Sure.
opportunity to ask questions prior to the meeting. Thank you.
Are we voting on the amendment now?
You mean on the change?
Yes.
On the agenda as amended.
Right. All in favor signify by saying aye.
Aye.
Opposed?
No.
The ayes have it. Motion is carried. We'll move on to public comment. Is there anyone from the public who would like to address the committee? Seeing none, I'll close public comment. We need a motion to receive and file communication items, the contingency report, the Health and Human Services Children's Village National School Lunch Program application, and the Michigan Department of Health and Human Services Board minutes from June 18th. A motion by Commissioner Powell, seconded by Commissioner Nelson. All in favor signify by saying aye.
Aye.
Opposed? The motion is carried. We'll move on to our regular agenda item. The first item is a policy to provide emergency contraception through the health department. Commissioner Gershenson?
Yes, I'd like,
Oh, I'm sorry.
Oh.
We need a motion. All in favor signify by aye.
The person that moved it, Nelson? No, I moved it. You moved it? Second.
Seconded. Opposed? The ayes have it.
thank you. So Commissioner Markham and I have brought forth this resolution. to have a discussion with our health department about providing emergency contraception. So I'd like to invite Kathy Forsley to the table, and would you like to join her?
Okay, good morning.
Good morning.
So, would you like me to answer a specific question or just start off with, what we'd previously discussed?
However you'd like to address it, or Commissioner Markham, do you have any preference on how this is presented?
No, yeah, I guess if you wanna
Sure.
start.
Yeah, okay.
And just introduce Deb.
Yes, this is Deb Brinson. She's the director or CEO? CEO, thank you. CEO of Honor Community Health, thank you, which is our federally qualified health center, which we are very much in strong partnership with. So at any rate, and you'll see why I've invited her here today, because of this partnership we have. I think there are things that we can do together. We don't believe that the health division is really the place to be providing emergency contraceptives for a plethora of reasons. We know that you can go without ID, and it's readily available at major pharmacies. You don't have to have an ID, you don't have to have a prescription, and we know that it's available at CVS, Walgreens, Rite Aid, and Walmart. You can even pre-order online at Walmart for a very, very low cost of $10. And the other ones charge, well, I had seen that there were some that ordered in 25, but our recent survey said it's in the $40 to $50 range at all these pharmacies. So as I said, you don't have to identify yourself. You just pick up a Plan B box, take it to the pharmacy, they open it up, take it out, give it to you, you pay for it and go. So other than that, if a person went to a clinical setting, which I think is appropriate, because this is an emergency contraceptive, there could be a lot of reasons why a person might be seeking an emergency contraceptive. And we believe that a full array of services around this to have the appropriate discussion with the person seeking this is, there are a variety of things that could be going on. Is this rape? Is it incest? Is it human trafficking? Or is it simply that you really need to be on a contraceptive, but you hadn't thought about that ahead of time, or something happened that you need this emergency contraceptive? Well, if this person is really needing contraceptives, that opens a whole gamut of potential solutions that need to really be geared to the individual. What type of contraceptive? This is not a business that the health division is in, nor do we have the proper staffing to be able to answer all of these questions, to do this work. We are very, very, very busy clinics that deal heavily with STDs and immunizations. This could be something that really, we really are working our level best to get people through in a timely manner in our clinics. These are conversations that could be quite lengthy. I just believe if they want to come to a clinical setting, that people like our partners, Honor Community Health, are the place to go. Also, it's also available at Ferndale.
Yeah.
Family Planning in Ferndale, and also at Planned Parenthood in Ferndale, and also in Southfield,
Gary Bernstein?
Northland.
Does Gary
No,
Bernstein have?
they will give birth control, but they don't have that. They maybe could write a prescription for it, I'm not sure. Honor can write a prescription for it, and Honor also operates on a sliding fee scale, but I don't think I'm the one to speak to that. You can speak to how you might be able to fill gaps with that.
Sure, would you like me to? So, good morning, I'm Debbie Brinson. I'm with Honor Community Health Center. We're pretty new FQHC. We've been in partnership actually with the health department for 4 years. We are very committed to addressing the high teen pregnancy rate as well as the contraception access issues here in Oakland County, but particularly in the Pontiac greater area. Honor does provide contraceptive services to women. It's on a sliding fee scale. We'll never deny anybody access to services. As a federally qualified health center, we're required to see anybody that walks through our doors. So if somebody comes in seeking family planning services or emergency contraceptives, we'll take a look at what their income level is and we'll slide them. If somebody says that they can't afford it, we'll still be able to see them. The challenge with the emergency contraception is that it is available over the counter, and so it used to be by prescription only. And so it's very expensive. A lot of our health insurance plans, our Medicaid health plans, or commercial insurance carriers don't cover it any longer because you can get it over the counter. And so it's $40 to $50 per dose. That can be pretty expensive. So we'll work with our partners to make sure that they either get connected with Planned Parenthood, if they can, in Ferndale or any place else. But our organization provides contraceptive services, provides the whole array of services. Just as Kathy was talking about, we're interested in when a woman comes in, we want to make sure that she's safe, that she's not been engaged in anything that has caused her harm, and that we're looking at long-term or situational solutions and resolutions for her. So that's just a little bit about what we do related to the emergency contraception services.
And one other location that it is readily available at is Oakland University's health clinic. They will not only see their students, but any student from any university or college for a cost of $18 for the visit and the medication, the contraceptive.
Is there an age range this applies to? What would be the youngest age you would prescribe this for?
So for us, we'll look at, if it's a minor coming in, we're looking at parental consent, what's involved with that. Often, it's not a requirement to have parental consent to give emergency contraceptive or contraceptive. By state law, they're eligible for those services. But we also know that a 13-year-old doesn't wake up and say, I'm going to be sexually active today, that there are other issues going on, and that's where we engage a social worker, a counselor engaged, make sure that there isn't anything going on, and often there are other issues going on. On the other hand, if a 16-year-old comes in and is seeking contraception or emergency contraception, then we're going to work with that patient as their individual right in choosing how they seek those services.
Commissioner
I
Powell?
just had a quick question.
Sure,
So
thank you.
your organization is the organization that governs the one in the high schools, right? In the
Correct.
Pontiac area?
Yep, yep.
Okay, I was just trying to
Yep,
make the
we run the
connection.
school-based health centers there.
Okay, thank you.
And keep in mind, you cannot do contraception in school, so there is no delivery.
If they was to leave, but they can come to the hospital, right?
Yeah, they can go any place for care, including their primary care doctor. Yeah.
Commissioner Todd?
Thank you, Deb, for coming. I just want to give you a hurrah for you because I have been to your place behind the mall, and it is as nice as any physician's office that we have in Oakland County. It's a beautiful, beautiful place. The equipment is sparkling, it was sparkling
is.
brand new. Your staff doctors are amazing. I think you do an incredible, incredible job. And again, I stress, you can walk in there without worrying about having enough money to get care. And that's a beautiful thing. Federally qualified health clinics, we have many of them in the county, don't we?
You have two in the county. So you have the wellness plan that runs through out of Detroit, but they have a location over on Woodward. They're open 3 days a week, and then Covenant is open 2 days a week over in Southfield.
And you are open?
We are open 5 days a week plus after hours, and we have 11 locations throughout Oakland County.
Okay, so we're talking about how many total, you have 11 locations.
We have
plus
11
Covenant,
locations.
That's 12.
Right, we don't operate Covenant.
I understand, but I'm trying to
Yeah.
put a count in my brain.
Yeah, so Covenant has one location and the wellness plan has one location.
Okay, so you have 11, so there's 13 places that people, or women, let me put it that way.
Correct.
Okay, the thing that concerns me about the health department doing this is, you know, I was in the 90s, that was a long time ago, you probably all weren't born then. But I worked very hard to make sure and got the very first grants that women who were raped, or men, would have pre-hospital care by nurses who are trained in this particular modality. And we continue that today in Oakland County. And I don't want young, especially young people where there might be a rape involved, not to get the proper care, and I don't know if we're set up to do this kind of stuff. I mean, and we're not open on the weekends, and we're not Sundays, Mondays, or holidays. I truly think this is best left, in my personal opinion, up to Deb and her folks, or the other two, you know, the 11 clinics, or the other two clinics. And I think you're also, I'm not mistaken, you're in, not, the place over, Oakland, one of the mental health places, Oakland Family Services.
Yes, we are in
Okay,
Oakland Family
so,
Services.
so people who would come to Oakland Family Services would also be able to have this service as well, and, okay. I just think that it's more than just taking a pill, okay? I think it involves a whole lot more. I don't think that we have physicians, do we have physicians on staff?
We have one physician, excuse me, on staff. He oversees all of the TB patients in Oakland County. He does see some syphilis cases, and he pretty much is orchestrating what's going on in all of our medical services unit, communicable disease units, and the laboratory. That's a big load.
Okay, so you don't have a gynecologist on staff?
No. And it's our goal in the health division, no matter who we're seeing in our clinical settings or even in our home settings, is to attach everyone to a primary care physician, a medical home. And we are constantly connecting our clients to Honor Community Health because they are a federally qualified health center. They can offer a full array of services, even specialties, under one roof. It's a beautiful thing, and we believe it's our job to really promote that as much as possible and connect people to them for a wide variety of services.
Yes. Do you know what it would cost excluding the cost of the medication, but what it would cost to staff this? And it would have to be staffed 24/7.
The problem is I was not able to get my hands on, how much is this being utilized because of the fact it's offered in pharmacies and, maybe a few places here and there that are also offering either prescriptions or the medication. It's unknown how many of these patients would be coming through our doors. But I do know that we are bursting at the seams, and we are doing our level best to get wait times down to something that's desirable for all the other services we're providing. So I just think that we normally try to fill gaps, and immunizations and STD work is an enormous gap in this community. And we're mandated to do TB and HIV. So between those services, they are really filling our clinics to the max.
Thank you, Madam Chair.
Thank you.
We would need another physician or another physician's assistant at least.
Commissioner Barkum?
Thank you, Madam Chair, and thank you, both of you, for coming and being prepared to discuss this. First of all, I don't think that this resolution is asking the county to take on providing emergency contraception. The wording specifically is that we shall provide the public with medically and factually accurate and unbiased written and oral information about emergency contraception. We should supply referrals, and we should, this is an important point, provide all victims of sexual assault who are seeking services or referrals to be provided emergency contraception. Okay, so, and there's a line in here a couple of times that says that it is our job to provide medically accurate and unbiased information about emergency contraception. And I'll tell you what set me off on all of this was a couple of months ago, the county decided they wanted to weigh in on the issue of family planning in a way that I thought was not medically factual and accurate. And so I started to just look into what do we provide, how do we provide it, how do we inform people of what's out there? Because as you say, you have all of these clinics, and I'm looking at them here, and you yourself, Ms. Brinson said, you mostly serve the Pontiac area, which is of course our biggest, one of our biggest low-income concentrations of people, and that's number one where we should be. But we also have low-income women in Oxford and Holly and Lyon Township and lots of other places in this county. And when I went to the county website to say, where can I get help with birth control? Where can I get emergency contraception if I have a problem? Yeah, it's in the pharmacies, I know, but it's $50. And a lot of these people you're talking about do not necessarily have access to a lot of information. So I then, after I looked at our website and couldn't really find anything on where to go if you are looking to access county help with birth control, which is federally mandated. So then I went to Macomb County and looked at what they had, and I went to Washtenaw County and looked at what they had. And they're different, of course, and they're different from us. But for example, Washtenaw County, 2 clicks, and I get a full spreadsheet table of this place is here, this place is here, this place is here. None of that is readily accessible on the county website. And I think that this issue of emergency contraception in particular, where someone most likely has had a sexual encounter that they either were forced into or regret immediately for whatever reason, we are trying to prevent unwanted pregnancies. That's my goal. I think that's your goal. And I think that this resolution to have the county be providing more obvious and more readily available information about where women in this county can go to get service is very important. And I think, frankly, right now, the information is either, if it's on our county website, it's really hard to get to because I went looking for it and I had a really difficult time. So that's what this is intended to address, and specifically to emergency contraception. But I think we have a bigger, I think we have a bigger question overall. How are we providing help to those low-income people that aren't in Southfield, aren't in Pontiac, our big low-income centers, but are elsewhere? Novi, where I come from, has 3,000 people in poverty, according to the local statistics. Where do those people go? How do they access the information that they need? And I think our county website needs to be updated, and I brought this forward because I think this information needs to be much more easily available, and emergency contraception needs to be publicized and known for those people who need it. So, thank you.
Commissioner Kokendorfer?
Thank you. So I'm looking at the resolution right now. I'm looking at the last, be it further resolved that the OCHD shall provide emergency contraception immediately to each victim who requests it. If the emergency reception is in the form of pills, the provision must include the initial dose, which the victim can take on site, as well as any follow-up doses for the sexual assault victim to self-administer later. So this resolution would require the county to actually provide emergency contraception. And one thing that I think Kathy mentioned is she mentioned this idea of the county being a gap filler, essentially. If fill in those gaps of where can we best serve our constituents. And that's really what I think everybody here always ask ourselves, how can we best serve our constituents? It doesn't sound like to me that this is a gap that is best filled by the county. In fact, it's being filled by many other locations. And I question whether this is the best way to serve our residents.
Commissioner Taub?
Deb, you said you have 11 locations for FQHCs, and as I recall, there's some type of federal qualification in order to open an FQHC. You just can't open it in the middle of Birmingham, as an example.
Correct. So we're like, as an FQHC, you have a rare opportunity here, because this FQHC is designated to serve Oakland County. It will not go into Detroit. It will not go into Macomb County. It will not go into Livingston. The board of directors, which is made up of both consumers from Oakland County, but also community members, have made that very clear. It can go any place and it can serve anybody, but in order to get dollars, federal dollars, it is going to be located in high concentrated areas where there are large Medicaid or uninsured individuals. So that's part of it. It's not that we won't serve Novi, won't serve Southfield, won't serve any place else. However, I do want to share a couple things, if it's okay, from my public health background too. I always think it's important that women and partners have access to contraceptive care services. It is the #1 predictor for having a healthy community, and to address infant mortality, to address school dropout services. If you look at any of those things, it is a significant strategy. So whatever this community is doing, I'm always grateful for the work that this community is doing to address that issue. Pontiac has the 3rd highest teen pregnancy rate in the state of Michigan. The 3rd highest teen pregnancy rate in the state of Michigan. So contraception, education services, morning after, a continuum of service is important. Whether it's delivered through the county health department or through someplace else, it's important. And it can go much broader and wider, and should go much broader and wider. But I hear a couple things that I think that I see. One is there isn't a lot of knowledge about Plan B and where to access contraceptive services pieces. So not being able to go to a website, it's giving me food for thought. Does my website say contraceptive services? I'm betting it doesn't. That's something that we can add to that. Educational pieces, I was driving by and one of my staff members showed me the HIV PrEP billboard discussion. It got a discussion going this morning that we didn't even know about. There are, I think, other opportunities that whether the county or the community come together to address that, I think are really good things. What you can't measure is the morning after pill or Plan B or contraceptive services, because individuals are either not going and getting it and becoming pregnant, and we don't know that, we don't capture that kind of data, or individuals are going and getting it and we don't know it, pieces. What I do know is that it's very, very expensive. So if there's anything for us to take a look at is how do we work to bring down that cost or to make sure that that piece, that resource is available to women and their partners, pieces. So I think it's great that this discussion's going on from somebody sitting out in the community. The first thing that I did when I came on board 5 years ago was who's providing contraceptive when I'm doing prenatal care services. Those go hand in hand. And there are not a large number of people doing contraceptive services in this community. St. Joe's does not do contraceptive services in this community. We ended up picking up a portion of their patients because docs couldn't afford. Contraceptive itself is very, very expensive services, the drug, the product piece on that. So I just wanted to kind of share my thoughts on it, that I don't think anything is ever lost by promoting contraceptive services and letting people know. And I don't think there's a lot. Generally, you have Planned Parenthood who is doing that in a community. They're in the Ferndale area. pieces. They're not globally within the community. We've begun having discussions with the state about becoming a Title X provider, services that allows for any woman to receive services. But those are all discussions and policy pieces that are going on and create interesting dialogues just like this. So whatever the county, the health department, we're right there in partnership with individuals. And I certainly will always promote women having access to contraceptive services. Equally important, knowing where to receive those services.
Yes. And I just wanted to comment that a lot of the things that you had talked about, Commissioner Markham, is very much what we do in the Health Division. We very much agree with providing factual information and services, unbiased, everyone that walks through clinic doors. There's no judgment. And we really want to do everything we can to give them services where we can, and then refer them to places where they may need more. We took a look at our website after we spoke to you, and we are now in the process of building a women's health, and we're gonna try to organize it differently. We've been under some constraints on how it's structured, but we've got some great ideas about how we can manage that. We can do some senior health, women's health, men's health, and try to organize things with a lot of links, and we agree with you there. We do have a lot of fact sheets that we utilize, and although we can't put everything on our website that has everything to do with health, we do recognize, as Deb has said, this is an important area, and we agree that needs to be out there, and we need to be able to show people where they can go. But one thing is we have relied heavily on our nurse on call in the past, places where we think need greater discussion. It's a wonderful thing when someone calls nurse on call, and we have tens of thousands of people that call every year to our nurse on call, because they can have that more in-depth discussion, and they are very well trained in maybe getting at the heart of some issues, trying to give them the best referral they possibly can. And they will even keep that person on hold for a minute while they call another organization if they feel this is something that has to be done today. We need someone looking at this person today. They'll make sure that happens. And they have a lot of good contacts in the community to be able to make sure it does happen. So nurse on call is something we have relied on, but you are right. The written word is important as well. And we're already working on an organization for that as well.
Commissioner Top?
Thank you. Kathy, would you be willing to work with Commissioner Markham and kind of go over what's going on those pages and
Oh,
the
yeah,
emergency numbers? So you would be able to put the FQHCs,
Yep.
on there as a referral point. My concern, again, I keep stressing this, is that sadly, a lot of this quote-unquote activity occurs on the weekends.
Right.
Okay, and by the time Monday morning
Well,
comes,
that's where the West.
I mean, I'm just,
I'm gonna have to bring you to the 21st century.
okay, maybe it happens during the week, I'm old fashioned. But the point is, that people asking for emergency help, okay, cannot reach you guys on the weekend, am I correct? Or is the nurse on call always on call?
We do have an emergency number, and people do call it for lots of reasons.
Okay, but would you be willing to, pass it,
We answer all the questions that come through there.
Okay, so you'd be willing to pass it by Commissioner Markham, and she may have some good ideas as well as to what to put there. In all fairness to you, I have found that our access to any information from IT, I don't care if you're looking for baseball bats, is very difficult to access. I go crazy with what I'm trying to access right here at the Board of Commissioners. updated our IT computers and they stink. The program stinks, it's worse than it was. They didn't ask us, they just did it, okay? And half the time I end up opening the same thing 40 times and writing notes, that's why I'm always scrolling through. It's not a fun thing to do, so, I would hope that we could figure out how to do it, IT for dummies. We don't need all this fancy stuff.
No, we've
And
got
how
some
people
good
can
ideas.
actually, access stuff, without beating around the bush. So, thank you, Kathy.
Commissioner Powell?
So I wanted to say that more information that we can get out, the better, especially serving Pontiac. Growing up there, knowing the teen pregnancy rate, this has been a challenge for a lot of years. So the more information in places that they can go and we can let them know is great. Now, my second question is, if a situation did happen on a weekend, like she's questioning, when they call in, do we have referral sites for them to go to over the weekend? Or do they have to wait till that Monday?
It depends on the situation, and because, if it's somebody that has been raped or we're worried about, we have specific places that we would refer someone to so they get a rape
But
assessment and, the rape kit and everything. There's so
Well, I
many
know in a situation like that,
scenarios.
like, of course, because if you
It just
go,
depends on the scenario, but, we have a lot of resources. I can't speak to all of the resources that Nurse on Call has, but honestly, they're able to find resources for people in almost every situation.
yeah, I mean, I kind of figured that, but I just wanted to kind of break it down and see if it was some details you could give specifically where they was at. But I understand, that's fine, thank you.
Commissioner Kokendorfer?
Sure, I am a huge proponent of making sure that the county is providing accurate, objective information, and I am all for making improvements to our website or otherwise. I think it's critical for women's health and a lot of other areas. For the reasons I stated earlier, though, I'm not comfortable with the county taking on this additional role of actually providing these contraceptives, only for the reasons that have been described. I just don't think it's a gap that the county should be filling, only because we have so many other providers doing so. But I do think that we could step up our efforts in providing that information.
The dialogue that's happened regarding the information available on the website and in written material is a valuable discussion to have. I did take note of your comments that you and your staff are busy with the tasks you have to date, and in order to do this, you would need additional staffing, which is
In order to do the website, you mean, or what are you saying?
to provide emergency contraception immediately to
We'd
each
need
victim.
additional space,
Right.
too.
I do take note of that and I hear it. So I think beginning with the development of more information on the website and written material is where we need to start.
Agreed.
Yes.
Thank you, Madam Chair. And thank you both for being here, and thank you guys for being on the front line and being, true champions for public health and then a whole array of health that Honor takes on as well. I look at this issue broadly in like three things. There's the information, there's access to emergency contraception, and there's the affordability piece. And on the information, I think that there's consensus around the table here is like, when someone our health department has an inherent level of trust built in because people are accessing public health. It's a public entity. People come to it for information, and we want the public to come to the public health, and then trust the information they're getting from it to be accurate. So making certain that we have that medically accurate information, a very easy way to consume, is absolutely critical. I think there's consensus around the table around this. On the access point, I want to just to say that we've got good enough access to emergency contraception or contraception in general in Oakland County is a false statement. And Honor does an incredible job, but some of those clinics are in schools, and you can't even talk about this stuff in those clinics, and so those are automatically off the table as access points. And then we're a 910 square mile county, and so being able to get access to to a clinic environment isn't always easy. And frankly, due to some new rules going into effect that the operation of some Title X providers is becoming a big question mark, how long that's going to be available. And so from the referral point of view, it's like if someone comes into the health department, which I will strongly encourage people, always be able to reach out to the health department. If you don't have a medical home, the public health department should be a place where you can go to get the information you need to go find things. I think that we do need to kind of take a point on like access points and like how to get the delivery of these services, and I think Honor is in a place to make a big dent in that, but it's still only so many limited places, and we're a county of more than 1 million people. And then there's the aspect of affordability. Yes, you can go into your CVS and get this over the counter. It is very expensive. And if we're serious about trying to prevent unwanted pregnancies in the first place, we've got a very limited time where this is effective and is proven very effective to make sure that to stop a pregnancy before it happens. And so there definitely is some utility, I think, from the public health department that we can acquire access to things at a cheaper cost because of our ability to buy stuff, and we're a public agency. But also, it may be the conversation is with Honor Health or whatever to help figure out how we afford to do this, because a sliding scale means the money's got to be coming from somewhere in order to operate. So there might need to be a conversation. I'm not saying that today, that we have the conversation about how we help pay for it, but this idea that, well, Honor Health will just take care of it. Well, if it's going to provide free access or a very low cost, below cost access to emergency contraception, that means there's other healthcare dollars not available to do other healthcare things. Because you've got to figure out how to make the pot work. And so there might need to be a conversation about what is the resource need to make certain that we're meeting the needs of the community. Those who have the ability to pay definitely pay. Those who don't have the ability to pay, it's absolutely critical we make sure that it's affordable and accessible. Because we do, I think for all the reasons that Deb mentioned, like how this is interlinked to a overall wellness public health system. So I think this conversation's helpful because it really takes on, it's the information, it's the access, the affordability issue around this narrow in focus. And then we have an incredible partnership with Haven it runs our sexual nurse examiners program, which I know that if a survivor of sexual assault comes to their facility, they make it available to them on site. I think we're unfortunately down to one site up here in Pontiac now, and so again, there's an access issue to some of this, and so I think there's more to that. But getting down to the information, I'm hearing very good things that this is a very positive first step, and then we can have a further conversation about how we get to, improving access to emergency contraception when it's needed in the very limited time frame that it's effective, and the affordability aspect, which is the thing that I'm also incredibly concerned for vulnerable populations, but anybody, frankly. Because if you drop me $50, and it's not always easy for individuals, particularly young people. And so those are my comments.
It's an important issue. We have a lot of important issues on our table. I think starting with the website and information would be the way to go. My concern about providing emergency contraception immediately at the health department is burdening our health department with space and additional staff. I'd like to see what our partners would be able to do with that initially. Yes.
Madam Chair, since I am one of the originators of this resolution, and after hearing everybody today, maybe we ought to pare this down to speak directly about the communication and so on aspect of it. And to do that, I would suggest at this point we remove the 5th, be it resolved. Be it further resolved that OCHD shall provide emergency contraception immediately. So take out that paragraph that says we have to provide it, and also the one on the back that's related to that. And then the rest of it is about beefing up our ability to provide information and access to victims. And I agree that I think we need to have a much broader, bigger discussion on the whole question of contraception across the county, but not as a part of this today.
Commissioner Markham, I like it.
Okay.
Commissioner Gershenson?
And as the co-sponsor, I agree with you. I can definitely support that. Do you want to include something about the affordability, the question of affordability, of a further discussion?
I would leave that for the bigger discussion we're going to
Okay.
have, because the whole question of Title X and
Yep.
all that is, as
Okay,
our chairman
that works
said,
for me. I'll second that. Was that an amendment? So I'll second it.
Any further discussion on the amendment? Commissioner Kokendorfer?
I just have a question, this is probably for the co-sponsors. So one of these be it further resolved, I just want to understand what this means. So this is, if I start, this is like the seventh one down, this is, be it further resolved that the OCHD shall ensure that each person who provides care to sexual assault victims has medically accurate and unbiased information about emergency contraception. What is that getting to? Because that speaks to like the doctors and other people.
That's right.
who provide.
That's exactly right. There are clinics in Oakland County today who are saying that they are providing family planning and birth control information, and it is not medically accurate, and they are stalling women from getting the care that they are requesting and need in the attempt to keep these women pregnant. And there are more of them in Oakland County than there are regular clinics. And so the whole point here is we don't want any money going to those kinds of folks. We want to make sure that the people we are supporting are people who are providing unbiased, accurate information.
So could you just say one more time which ones we're striking, just so I understand?
It would be the 1, 2, 3, 4, fifth one down,
Okay,
and then the one on the back.
The one you objected to in the first place.
Right.
got it,
That one.
And the one on the back, which is related about,
got it,
if we are providing it, then it's got to be this way.
okay. Got it, thank you.
Any further discussion on the amendment? Hearing none, we'll have a roll call on the amendment.
Powell. Kokendorfer.
Yes.
Christensen.
Yes.
Nelson.
Yes.
Taub.
No.
Loops.
Yes. That motion is carried. And now we need a roll call for the motion, resolution as amended.
Kokendorfer.
Yes.
Gershenson.
Yes.
Nelson.
Yes.
Taub.
No.
Powell. Loops.
Yes. Commissioner Gershenson.
I just would like to thank Deb for rushing here. I really appreciate it, and Kathy for putting this, being so open about having this discussion. This is such an important issue, and we really appreciate your willingness to discuss it. And then we'll discuss whether or not you're gonna come back at the next meeting.
Great.
Right.
Okay. sounds
Thank
good.
you.
Yes.
I need to step back for a minute. The motion for the amendment was made by Commissioner Markham, who is not a part of this
Right.
committee. So you'll make the motion. We need a second then by Commissioner Nelson. Thank you.
And if I could just second what,
Do we need to vote again?
what
Thank you.
Member Gershenson said, thank you very much for being here and for being so open and willing to, kind of talk about where we need to go with this. Thanks to both of you. Thank you very much.
Appreciate it.
Thank you, everybody. On to our next item, the Department of Health and Human Services Health Division interlocal agreement with Oakland Intermediate School District for public health nurse services.
Good morning. So this is a request to approve an agreement that we've been working with Oakland Schools for quite some time now.
Say,
Yeah.
I'm gonna interrupt
Sorry.
you for a
I'm
moment.
sorry.
I need a motion and a second. Motion by Commissioner Todd, seconded by Commissioner Powell. Thank you.
Sure.
Sorry.
No problem. So this is an agreement that, as I said, we've been working on for some time. The idea is that we would use an existing position and they would pay half the salary. Our nurse would move over into Oakland Schools and work with all of the school districts in terms of looking at policies and procedures for a variety of things that we are concerned about with public health, such as what are their policies regarding the storage and the use of EpiPens. Every school is different in how they might handle that. We're gonna take a look at those through the lens of a public health nurse as to what their policies and procedures are. Take a look at where there might be gaps. Where do we need to build a consistent policy that's utilized throughout all of the school districts? And it's not just EpiPens, it's a variety of issues and how they handle sick children and how they handle immunizations and on it goes. At the same point, at the same time, from a public health perspective, we also have keen interest in this because we're very interested in how they're handling social determinants of health issues as they come across them, or are they even aware of them in the same way in every school district. So eventually that is something that the public health nurse would take a look at as well. There's a lot of things that we can do to help with policies and procedures, even assessments regarding that, as well as bringing back shared information to our community collaboratives that we facilitate that are very much interested in how social determinants of health are impacting everyone in the county, but in this case particularly school children. How is that impacting their success in schools? So we would, for now, as we're just getting this going, we know this is going to evolve over time, but we will use one of our existing positions, and as I said, receive reimbursement for half the salary and the expenses, the mileage and all of that from Oakland Schools in this agreement.
Thank you. Commissioner Todd?
I guess I'm gonna stand on a soapbox now. Kathy, is there any movement at the state to do more about immunizations? Because this last measles outbreak was horrendous for this county, for this state, and for people in this country. Is there any movement at all toward it used to be in the old days, everybody had to go to school, they had to be immunized. Now they can walk in and have every communicable disease available and it doesn't matter.
So for this particular outbreak, you're correct. We are working very hard on trying to inform a community about the importance of immunizations. This is something that's going on across the country as there's a growing number of individuals that are choosing either not to immunize their children or they're choosing to utilize a schedule that they think is more beneficial for their child. That's something every state, I think, in the United States is working on this problem right now. When it comes to our measles outbreak, for us it's a very different picture than it is in New York or other jurisdictions across America that are experiencing an outbreak. For us, it was a situation where we discovered that the population that was most impacted was perhaps, say from 20 to 50, even 60s, where they either never were vaccinated or they didn't receive the second recommended dose, which was a later recommendation that came out, and they were probably, in high school or something and somehow missed it. For us, that was the population that we had to really direct all our focus on, and when we did that, we were able to really encourage a community's older population to become vaccinated. And that's what we believe was the success story to being able to end that outbreak.
Commissioner Todd?
As a follow-up, do universities and colleges require kids to be immunized today?
It's not the same kind of requirement. There's recommendations, but it's not, we won't enroll you if you're not vaccinated. And in elementaries and high schools and daycares, if someone chooses to go against the recommendations, they have to come to the health division to receive a waiver and they get an educational session. We found that to be useful, and that it may not be immediately effective. We've seen that our waiver rates are going down.
Any
Thank you.
further discussion on this item? Roll call, please.
Gershenson,
Yes.
Nelson,
Yes.
Todd,
Yes.
Powell. Yes. Okendorfer,
Yes.
Moves.
Yes. Our next item is Health and Human Services Children's Village Intensive Family-Based Reentry Program Creation. And need a motion? Motion by Commissioner Todd, seconded by Commissioner Kokendorfer. Hello.
Hello, I'm Jody Overall, Manager for Children's Village. This is a partnership between the Family Division of the Circuit Court and Children's Village, and it's a new program that we've developed that's unique and different in the sense that the bulk of the programming will take place in the child's home with their family and in the community instead of at Children's Village. The program will consist of 30 to 45 days at Children's Village, court-ordered, and then a transition period home, and then between 2 and 4 months of family-based programming within the home. Children's Village would need to add 2 full-time clinical positions to our budget, as well as a reentry specialist to provide those services. The court has a existing caseworker that they would assign to this reentry-based program. It would be intensive probation. We would continue to work very closely with the court on that component. And then there are some materials that would need to be added to the Children's Village budget and the court budget. Funding for those materials would come from the Department of Health and Human Services administrative budget. And all of this program would be 50% reimbursed by the Child Care Fund.
In the funding, professional services for the fiscal year 2019 is 2,400, and no professional services in the upcoming year. What are professional services? What's in that category?
That is actually for the court, your professional services.
That's training for a new assessment tool that's going to be used, and also electronic tethering monitoring.
Thank you. Commissioner Todd?
Thank you. Jody, are you working with Oakland County Youth Assistance as well? Because I think you are in Birmingham too.
Yes.
Once the kids have finished their time with you, then they're gonna go, I'm trying to follow the path they're gonna take. So they're gonna go home, and they'll be 30 to 45 days working with, what?
So they will be court-ordered into Children's Village for 30 to 45 days.
Okay,
During that period of time, Children's Village treatment staff will do risk and needs assessments, meet the family, set the groundwork for treatment programming, and then there'll be a transition period where they actually transition back home. That's when the court intensive probation worker also will get involved. And this is driven from our reentry process, which Youth Assistance is very much a part of. They helped us establish it as well as the court. And so Youth Assistance will be involved in helping provide services and resources for the kids and the families when they're at home. So they'll work with the reentry specialist.
okay.
And, whatever services YA provides based on the community they're in, they would be engaged by our reentry specialist and provide those same services to the family.
Okay, so if in Children's Village you find, or maybe shortly thereafter, Youth Assistance can provide some funding for, say, I don't know, a light bill or electrical or a water bill or something of that sort, as well as counseling for the kid as the kid, because the child has to go from your shop back into school, obviously. So there may be some impediment, and that's where youth assistance comes in, am I correct?
Yes, we currently use them now. They have funding, I think, approved by the board. And so if we want to send someone, our reentry, Children's Village reentry specialist, I think probably the court also, if we want somebody to go to camp and they can't afford it, or they have a light bill or a car payment, something they need to pay, youth assistance has the means for us to be able to make that request.
But it's not provided by the Oakland County Board of Commissioners at all. Though that funding is called an angel, okay? There's somebody who funds those dollars at Oakland County Youth Assistance Board. And then the local social workers know that if they need a car payment made or a rent payment made or, you know, heat bill paid for, they go to Mary Schusterbauer. And the rest of the money is not.
Okay.
Okay, only the social worker is paid for by this board or by the courts. Everything else, all the other funding to youth assistance comes from the individual organizations raising the money for it. So that's it, I mean, period. And the local communities, the local school districts provide an awful lot too, but not this board. Okay? Just, yeah.
Commissioner Nelson?
Thank you. In regards to the kinds of assessment tools and materials, what is the assessment tool that will be utilized?
We have an assessment center at Children's Village. They will provide several. I didn't bring them here. We have a MJAS, which is the Michigan Juvenile Justice Assessment, and that assesses criminogenic risk. So that is a tool that is probably one of the most important, helps determine the likelihood of a child to recidivate or commit another crime. And then we reissue that assessment throughout the course of their involvement with the court, and certainly during the course of their placement at Children's Village. We also do the CAFAS. We do a substance abuse assessment.
And these are these empirically supported?
Yes,
Okay.
yes, yes,
Thank you.
yes.
Any further discussion on this item? Seeing none, roll call, please.
Nelson,
Yes.
Cobb,
Yes.
Powell. Kokendorfer. Gershenson.
Yes.
Lubes.
Yes. Motion
Thank
is
you.
carried. Thank you.
Thank you.
Our next item is Area Agency on Aging 1B, the annual implementation plan for fiscal year 2020 to 2022. I need a motion. Motion by Commissioner Powell, seconded by Commissioner Kokendorfer. Welcome.
Welcome, thank you for having us. Michael Carson, CEO, Area Agency on Aging.
Jim McGuire, Director of Research, Policy Development, and Advocacy at the Area Agency on Aging.
Every year we come here and we talk about our annual plan, and then we're lucky enough to have a 3-year plan, which is part of our funding. And today we want to talk about our 3-year plan and some highlights of it, and I have some things to pass out as well, and I'll get those to you before we leave today. There are 620 AAAs, Area Agency on Aging, throughout the country. It was formed by an act of Congress and supported by the state legislatures in each state as well. Currently, we have over 737,000 seniors that we care for in our 6 counties, which make up Oakland, Macomb, St. Clair, Monroe, Livingston, and Washtenaw. 30% of the senior population is in these 6 counties, which really makes up only 5% of the land mass of Michigan. So you can see that we're very highly concentrated in doing so. Last year, we served 22,167 people in Oakland County, investing just shy of $20 million. So we're really proud of the work that we've done and the partnership that we've had with the county. Today, we just want to talk more about our multi-year plan, and following approval of the commission, then we take this, we go to each county, we get approval, then we take it to the state of Michigan, where we go in front of the Commission on Aging and get their approval. Then we're held accountable, obviously, to meet this plan as we go forward. We had hearings. We had 6 public hearings, and we had 1 in each county. And then we had a final 2 hearings. We had 1 in Southfield and 1 in Ann Arbor, to just get some more information and feedback. Anything that we heard was incorporated into our plan as well, anywhere where that was possible. And In doing so, we've drafted the final version that we're coming forward with today. We invest our funds in two ways, with grant awards for community organizations, and we provide direct services. We also this year have done something different. Within our categories, we're allowed to spend money, and we've only had a very small amount of areas that we identified. And this year, we're doing something different, that we're putting $1 in many categories, which will allow us throughout the years to either start programs as we feel the need and to move funds. And this will allow us to do this without going back in front of the Commission on Aging in Lansing. So it gives us a lot more flexibility and to be more responsive as needs come up for our community, and to really make sure that the money is going in the proper course. We're also doing something called gap filling, which is something new this year. It's really for unmet needs. We're budgeting $10,000 for this fund. It's for a one-time occurrence for people that have something that really is needed that we can help them with. It could be repair of a front door to make sure that their home is safe. It could be anything from grab bars to helping with a rent. It could be whatever's needed. So our goal is to have almost this emergency fund to help and be responsive to our senior population. And in doing so, the county has been really helpful, and the $600,000 that was put forth to help us move people in our community living program has really done wonders. We want to thank you for your support on that as well as we continue to move that forward. In 2018, some of our most popular touches, what we did, our Information Assistant, which is our resource center. It's currently open 5 days a week. We have unbiased information to anybody that calls. So it can be on any resources, whether it's public or private, as well as some programs that we have internally. So we move that forward. Our congregate meal plan is growing. We have more needs for more sites, and we're looking at those always. And of course, home delivered meals or Meals on Wheels is a great touch. And not only do we provide services for that, but it's also an opportunity for the people delivering the meals to check on the well-being and to make sure we're avoiding complete isolation for a lot of the seniors that are living, by themselves. So again, great programs. Currently, our most funded programs are home delivered meals, congregate meals, our community living program, and that's a program for people that call up and they need additional services, and that's what the $600,000 really deals with, our zeros, the people with highest need, to make sure that people are getting those services right away, and our dementia adult day services as well. Under the new program, we want to do a lot with research and demonstration of different projects for evidence-based data. We do feel that it's important for our advocacy to really talk the story and have the data behind it to back everything up. As we do that, we're moving to more of a strategic plan at the state, federal, and local level to support our older adults, and we're measurable and reporting outcomes for our contractual services. So as our services go out, we want to hold them more accountable and make sure that we're getting much more services to be able to justify what they're doing and how well they're performing. And of course, we're proud to say that we started a philanthropy program at our agency, our first year into it, so that's moving forward. So we want to make sure we continue with our fundraising as well as grant writing. Our grant writing program has really taken off under Jim's direction and his staff, and we're getting tremendous grants that are really allowing us to look at different areas of seniors and how we can serve in all of our different counties. And then public transportation, which is a huge issue. So again, another focus on public transportation and what we can do and how we can help be a partner with whatever's going to happen at the local levels and the funding. We do know that, as Jim mentions many times when he speaks, door through door of getting people, helping them get out to the vehicle, getting the transportation and getting them back in, and whether that's meals being delivered to be brought onto their counters, or even medication. So transportation, again, is a big push for us as well. And then the additional resources of caregivers and family caregivers, we have to really start looking at who can provide care and services. There's a shortage of caregivers in the state of Michigan and throughout the country. The pay's not great. It's not really seen as a profession, and a lot of times there's family members that are able to provide care and service. And how can we incorporate using them and their services and help them so we can provide care more reasonably and make sure it's a safe placement? And then a wellness program to make sure it's throughout our market, and also looking at private funds to see what's available in that area. Our medical nutrition therapy is our dietitian really looking at helping people with dietary needs, especially diabetes education, to help them lead a healthier life, avoid unnecessary health care. And one thing that we heard a lot at our public hearing with grandparents raising grandchildren, it seems that through the opioid problem and drug abuse and just bad family units, that a lot of grandparents, and not just grandparents, could be aunts and uncles and other older members of the family, have taken on the responsibility of raising younger members of the family. And in doing so, it's really a financial hardship for them. And a lot of them are making decisions between their medication and their food and how to get services. And so there's a lot of work to be doing on advocacy to make sure that if they were doing foster care for the children, there'd be funds from Lansing, but in this situation, there's not. So a lot of advocacy and promise in that direction. So really excited about our plan, and we're excited about what we're doing. Of course, we're going to continue with all of our core programs and everything that we currently do. And as we move forward with our agency, we're looking at all different aspects for our future strategic plans of ways that we can continue to meet the changing needs of our senior population and adults with disabilities. And we want to become the leader, obviously, in some of these forefronts throughout the state to set the example and the standard of what needs to happen. We would love your support.
Thank you. I'm not sure about every city in Oakland County. In the cities I represent, we have the SHARP program, which are a group of volunteers that would assist seniors in putting a bar in, where the items you described as the gap filling program. Do you work with the SHARP programs in the cities?
Jim might be able to answer that better. I'm not aware that we are currently.
Not currently. It does open up the possibility of a SHARP program that needs to pay for materials or something like that to go to us if they have no other local resource. So that's what the gap filling is for. But since it's new to us, we'll just have to start this outreach.
Right. And the other item regarding transportation, some cities also have senior transport services through SEMCA and a grant for the smaller bus. Do you work with those cities to provide transportation?
We do. We have an amazing transportation department, and we utilize all the different services that are out there for medical, non-medical, trips to the grocery store, post office, drugstore. Yes, we do. And we're always looking to partner with even more.
Thank you. Commissioner Todd?
Do you still have, I have a few questions. I just wanted to commend you, if you still have the program where you will, take a look at all the people who are providing transportation and vet them so that people who can afford to pay for, say, transportation or home care, but don't know exactly where to go, you can give them some recommendations. Do you still do that?
We do. We vet all of our programs. We do have some level of standards, and we do vet them. And we have, like I said, a very dynamic transportation department at the agency. So when people call up, we help match that. And I was also reading an article that appears that Lyft might be doing something with Medicaid for the first time. So that would really open up a tremendous amount of opportunity for seniors to get much more enhanced services. But I would say there's still areas that are not served well, and that's one of our big problems. And
Well, I think for those of us who had not have anymore, parents who needed wheelchair transportation and could afford to pay for it, but just didn't want to turn grandma over to, any old person, it was wonderful in my circumstance, and I want to thank you. In the resolution, it says that there were some constructive changes in the plan made as a result of some comments. Do you remember what those might have been?
Sure, and what I'll do is I will let Jim start speaking, and I will pass these out.
Okay, and then I have another third question, or third comment.
Yeah, an example of that at the public hearings, some of the staff who work with grandparents raising grandchildren programs pointed out that there's a need for respite. There's a need for respite services where in our current respite services, we're providing an aide to watch the older individual so the family member can go, but it's a whole different ballgame with grandparents raising grandchildren. You need essentially a babysitter for the children so that the grandparents get that respite and break, which those of you that have had children know you desperately need under the best of circumstances. So that's something that we modified in our plan and in our public policy. It raised a lot of policy issues as whether our dollars could be used for that particular purpose or not. It's something we have to research. It involves federal stuff, so we added that respite issue to the language of our public policy platform that we intend to address.
And then I have a final comment, if I may, Madam
Yes.
Chair. You sent us a flyer that says snapshot of the fiscal year 20-22. Do you know what I'm talking about?
Yep.
Okay. And there are two little boxes below there. There's a circle, funding allocation by the service type, and who we are and who we serve.
Yes.
Okay. Now, if you jump down to a statement you made, it starts an estimated 737,000 older adults. You
Yes.
see that?
Yes.
You left a word out. Remember, I read everything. So, and you left a word out. So you need to put a word in there and reprint it. It's right here. Yeah. On that it says, an estimated 737 older adults and live in the AAA 1B region. Either you strike the word "and" or you add something before. Does that make sense? No,
Yes.
that's true.
That's a good point.
So,
The "and" should not be there.
Okay, so I think that you need to reprint this thing, because shouldn't be there.
Thank you.
You could say work and live, but they don't, most of them don't work.
I'm just
Now,
glad I was
and
pointing that
I have,
out.
yeah,
I'm
sorry,
just glad I
Michael,
was-
you know, I read everything, so,
I'm just glad I was passing out paper while you were picking on Jim, so.
yeah, that's right, there you go.
That's right.
One other thing, what are your income I mean, I understand, where do you draw the line on income, and you say to people, okay, I know you need services, but you're gonna have to pay 10% or 15% or 100%. How do you figure that out?
There's a lot of different programs that we have. Some programs require that you are Medicaid eligible. Some programs are a cost share where you could pay what you can afford. So all the programs are a little different. I mean, most people are below poverty level that we service. But to your point, all of our programs are a little different that way.
So, if I may follow up, so somebody, say a couple, lives in a kind of a nice house, you know, and it's well cared for, but their income level is not high. Do you then demand that they sell their house?
We do not. There's a way that we can calculate looking at just the person that needs the service, separate from the spouse. But we do look at assets. One of our biggest program, one of our largest programs is our My Choice program, which keeps people out of nursing homes. So they have to be nursing home eligible. And to do that, you have to have Medicaid. So it's for people that have Medicaid, that have this nursing home eligibility, and then we provide services in the home. So the goal is to keep them out of the institutional setting. Then we have our community living program, which is funded, which is part of that zero fund, that, you know, we've always had the ability to ask for, you know, pay what you can afford type of program.
Okay.
But it really depends on our funding. If we have a lot of funding coming in from the government, that year we have to spend our dollars in that area. We don't always ask for that, but we have the ability to do so. So it is based program specific. So at this point, we're in a good position financially, and we're able to service as many people as we can.
Okay, your meal, one more, last one. Meals on Wheels. I understand there's been a change in the program this year. If somebody has a car in the family, they don't qualify or something? What did I hear about that?
That I don't know. You have to be homebound in order to get the meals.
Okay, but if you,
I've not heard, have you heard anything about a car?
somebody who drives in the family,
I'm not aware of any kind of a
would
change
you check
like
on that, Michael?
Yeah.
Or one
I
of the
will.
two of you, Jim, because
Yeah.
I had heard that if in a family, let's just say the wife can't fix any meals anymore because she's home, you know, whatever the reason is, that if the husband can drive, they don't get Meals on Wheels, or if there's somebody in the household, let's say the mother, a driver, yeah, that they don't qualify for meals, or they have to pay.
I'll find out. If it's okay, I'll see
Yeah.
Penny probably
Do
sooner
people
than
have to
that, and I'll
pay
give
for,
her the
can people
information.
pay for Meals on Wheels?
Yeah, but I'm trying to understand, I've not heard the car.
I heard that from someone who, I don't remember.
Yeah,
Yeah,
I'll check.
and I think I heard it from the people who are looking to have Oakland County pay for a kitchen in the western part of the county. Do you know anything about that?
Well, Well, we have a lot of contracts that we have, I don't know, do you?
Yeah, I'm aware that our nutrition provider that serves Livingston County and Western Wayne County, they're losing the space in the church, I believe, that they've been preparing the meals at, so they're looking for a new office and a new location to prepare meals. And they're somewhere along that Oakland County Livingston border. I know they're talking to the Livingston Board of Commissioners about helping to provide the financing as well.
Well, they want over $1 million from Oakland County, but then that would leave out everybody else in Oakland County who works out of churches or schools or wherever to provide meals.
We have approximately six contracts in Oakland County to provide meals.
Okay.
So we have a lot of different contractors already. One of the things that we have, though, is the way the meal program works, they kind of bid for how much money they need for the year, and then we take that money and allocate it accordingly. It's really important they spend the money, and some of them do not spend the money. And if they're not serving the area properly, then we will start taking money back that we've not done in the past. So we're trying to bring in more competent contracts, if you will, contractors, to make sure that they're meeting the need. And some of them also, there's a requirement that they open up congregate meal sites, and some have not been willing to do that in some cities as well. So we're taking a really hard look at our contracts to make sure that the ones that are serving are doing a good job. New ones coming into the market, we're always looking for new, but at one point we were even talking about, can we consolidate Oakland County to one contract? Can we have one contractor that can serve all the county? So we're not dealing with so many different entities, different menus, different requirements and everything else. So we are looking at that way.
But you do have dietary requirements.
We do, absolutely. All the menus have to be approved.
Okay, so you have some people, okay.
And
Thank you, Madam.
We do on-site inspections as well.
Thank you, Madam Chair.
Thank you. Any further discussion? Roll call, please.
Cobb,
Yes.
Powell. Yes. Kokendorfer,
Yes.
Nelson,
Yes.
Roots.
Yes. The motion is carried. Thank you.
Thank you. Thank you very much for allowing us to come.
Thank you. Next item is a presentation by Clean Water Action, and I want to thank you for your patience.
Thank you very much for having us. Thank you very much for having us today, everybody. My name's Sean McBrearty of Clean Water Action, and this is Meredith Gillies, our Southeast Michigan program organizer, who does most of our work focused here in Oakland County. First of all, I really want to thank you all for taking a look at what we think is a very important issue of septic waste contaminating waterways that really happens across Michigan, and frankly happens anywhere where there is a septic field. The thing is, there's different ways of dealing with it and making sure that a septic system is working properly and is not contaminating groundwater sources. I'd also just like to say, Oakland County does have some of the best septic siting requirements and some of the best requirements to make sure that when a field is actually being built, it's being done properly. After that, there isn't really follow-up. And Michigan is currently the only state, if we take a 10,000-foot view of this, Michigan is the only state without a uniform statewide sanitary code that requires inspection of septic systems. Statewide, about a third of Michigan residents live in a place where they have a septic system. The other 2/3 have sewer systems. And right now, if you're living on a sewer system, like many of us do, you're paying a sewer bill to make sure that your waste is being taken care of properly and not going straight into the river behind your house. The same cannot be said everywhere about septic systems. We currently have 11 counties in Michigan that have their own septic codes, and the other 72 counties don't have any sort of a requirement that ever requires testing or looking at a septic system once it's been installed. Last year, we did an informational presentation like this to the Oakland County Board of Commissioners, and in the aftermath of that, there was actually a state sanitary code bill introduced. And so I did want to give folks a little bit of background on that process as we get started today. So with that bill from last session, it was co-sponsored by Representative Lauer from Western Michigan and Representative Hammoud from Wayne County. And so it started out as a really good bipartisan package that was strong enough that we, with a couple little tweaks, we would have been able to support. Unfortunately, the bill did not run that way. By the time it made it to the floor of the House, which was during lame duck, all of the really good provisions had been dropped out of the bill, and it had become a bill that A, preempted counties from having their own regulations, and then B, created this statewide septic inspection program that said that they would inspect septic systems whenever there was reports of a failed septic system. So roughly the equivalent of inspecting a bridge the day after it falls down and then telling you what the problem was. So that's sort of the backdrop, and we're anticipating that a state bill is likely to be introduced again this session, and we hope that they get started, along the right lines like they did last time, but it doesn't go off the rails. Another important part, just to work into this, two of the main interest groups sort of involved in septic interests, and I was really glad that last time folks from the Oakland County Board of Commission reached out and brought in the Oakland Realtors Association, because realtors, in a lot of cases, and in fact, the 11 counties where we do have septic codes in Michigan, all of those counties right now have point-of-sale ordinances where a tank is only, or a septic system rather, is only inspected at the point of sale of a home, which has been shown to cut down on the problem of failing septics. However, you're missing a lot of the worst offenders, the farmhouses that stay in one family for generations, are never getting their systems inspected, and those are the most likely to be, leaking, or in some cases, they've actually found a straight pipe running from the farmhouse straight out to a creek. I have a map that Berry and Eaton County Health Department put together that has a lot of examples of that. Not quite the nicest thing to look at. So I just wanted to give sort of that overview of sort of where we are now on septics to enter this conversation. Meredith, you want to walk through? I'll control the slides here.
Yeah, sure. Just a little bit of background on who we are. So, we're a national organization, and in Michigan we have over 250,000 members. And Oakland County is actually the area where we have the largest concentration of members. Not surprising, as Oakland County has been, pretty much a leader on a lot of environmental issues in the past. And that's one of the reasons why we have, focused here in Oakland County to work on this septics issue. From the statewide level, we currently have 9.4 billion gallons of raw sewage leaking into our groundwater annually. That's an estimate that comes from the DEQ, and that's from failing septic systems specifically. So it's a huge problem statewide, and that's supported by the study done in 2015. A scientist at MSU studied specifically waste from human waste, and E. coli traceable to that was found in all 64 rivers that were studied. So 100% of the sample came back with high E. coli levels. And this region has been seeing an increase in E. coli problems, advisories, beach closures, really all over the region. So it's clearly a big statewide problem. So how much is it affecting Oakland County specifically? So we know that Oakland County has between 80,000 and 100,000 septic systems. And based on those statewide failure rates, it's estimated that between 10 and 25% of those systems in Oakland County are leaking. This is a huge problem, as Oakland County has the most inland lakes of any county in the state, and it also has all 5 of the watersheds in Oakland County have been found to have E. coli levels in at least part of the watersheds that are exceeding federal standards. So we know that there's high E. coli levels across the county in all of the different watersheds. So we also know that over 2,000 of the septic systems that failed from 2011 to 2015 came from Oakland County. So that's about 10%. So extrapolating from that, if Oakland County is accounting for about 10% of statewide rates, that means just in Oakland County we have about 940 million gallons of raw sewage going into our water. I don't think we really need to expound upon why that's a problem, but E. coli poses a lot of public health threats, and it also prohibits our enjoyment of our waterways, which is a huge problem.
Yeah, thank you, Meredith. And, you know, just to stress as well, a lot of the numbers that we've used here are estimates that are coming, and we used MDEQ because Deagle has not actually looked at this yet since it's been reconfigured into a new department. But a lot of these estimates have not been really tested and proven. It would be very good to do tests. Dr. Rose's study from Michigan State that Meredith referenced, the main finding that she had was that there was a direct correlation between number of septics in a watershed and the amount of E. coli they were finding in the water. So you know, with all of the numbers in here, it's really hard to tell until you actually get. So for instance, in Berry and Eaton County, they predicted about 15 years ago that 10% of the septic systems in the county were failing. When they actually did have a septics program for 10 years and looked at every septic at the point of sale, they found that the number was closer to 30%. So it's really hard to get actual accurate numbers until you go in and do a study and figure out exactly what the failure rate is. But almost everywhere that they've looked at this has fallen within that 10 to 25% in Michigan of a failure rate. And again, you know, I guess it is sort of a strength really that you can see it, because so with the 10% or so of the reported failures of septic systems coming from Oakland County, at least there's a strong reporting mechanism here that there likely isn't in several other counties. Just important things to keep in mind with this. And then, so county level septic codes, like I said, 11 of Michigan's counties have done this so far. And, you know, I think a big part of the reason why none of these have really reached up to the state level and become an example that the rest of the state is following is because it's been a contentious issue everywhere it's been done. There's been the realtors on one side of the table, the environmentalists on the other side of the table. And really, the conversation's changed a lot recently because the environmental groups no longer really like the point of sale approach. It's one way to do it. It makes the problem a lot easier to deal with. But the realtors don't like point of sale. We actually don't like point of sale either because it's not really the fairest way to deal with the program. If a house changes hands once every 3 years, let's say, there's some property that just keeps selling, that just keeps getting sold, you're going to be looking at the tank constantly, whereas the property that sits with one owner forever is never being inspected, and that's likely going to be the offender. So getting away from point of sale is important. If there is a county that can show that it can be done correctly, I think that would easily become a model that the state would then be able to pick up at the state level. EPA recommendation is to inspect septic systems every time they're pumped, which they recommend every 3 years. Now, that can vary greatly also based on occupancy of a house. If it's a house with a septic field designed for 6 people and there's, you know, a retired couple living there and it's just 2, or whatever the case may be, that obviously the time limit can vary there. But the EPA recommendation is to inspect every 3 years along with pumping. And then regular inspections versus point of sale. The reason why we prefer regular is that it ensures that each system is, again, being inspected. There are many ways as well to work around point of sale ordinances. For instance, in Ingham County, they recently had to, or they're in the process rather of making an adjustment to their point of sale program, because if a house is bought on a land contract, they can get around it, and different things like that. And then also the lifespan of a septic system is generally 15 to 25 years if it's properly maintained. So with point of sale, many systems are going 20 years or longer without being inspected, period, which is, again, you know, about the lifespan of the system that we're looking to have inspected. Another benefit, regular inspections are the best way to make sure that septics aren't posing a threat to public health or damaging lakes, rivers, or groundwater. Regular inspections also promote regular maintenance, which is cheaper for the homeowner in the long run than replacing a failed system that fails because hasn't been properly cared for and fails early. Much cheaper for the homeowner to be able to have that regular maintenance and, you know, keep a working system working. Average inspections nationally cost $237. with costs ranging between $70 and $490. And those numbers hold up for Michigan and the 11 counties that require inspections. Most of them charge somewhere between $200 and $350 for that inspection. With the higher end in some counties is closer to $400 to $500, depending on the way the county administers the program. But then septic replacement, on the other hand, if the tank fails early, can cost anywhere between $10,000 and $25,000 is average, and that's depending on, again, what kind of soil you have, what kind of a system you need. If there's heavy clay soils, a lot of times we'll have to build big mound systems, whereas like a sandy soil will filter much better. In the counties that do have septic codes requiring inspection in Michigan, it's done a couple different ways. There are a couple counties that have health department staff conduct all inspections. However, that is rather unwieldy for the health department generally. It's something that requires quite a bit of staff, especially depending on the number of tanks that you have to inspect. And then other counties have a system where they allow private contractors trained and certified by the health department to conduct inspections. And that can be done, that can definitely be an efficient system. Some of the things that really have to be watched for with the private contractor side of things is adapting sort of transparency clauses. For example, making sure that a contractor who conducts an inspection can't then go in and do the repairs that they're calling for in the inspection. On the alternative side of that, doing some sort of quality control to make sure that people aren't accepting more money to pass something. That's also, believe it or not, been an issue. So health department oversight is critical with a program like that, because the health department would then have the ability to decertify private contractors who don't follow the rules, and it's often good to have a strong financial incentive for them to follow the rules by being able to levy a fine if they're not following the rules on how to conduct the inspections. Another important thing is, one of the changes that we wanted to see to the statewide septic bill from last year was in the initial bill, they had 10-year regular inspections of all septic systems in the state, which was great. But the inspections were only of the septic tank itself, not of any of the other components of the system. And the tank is really just a big steel tank. They can fail, but they aren't the likeliest part to fail. The drain field is much more likely to fail first. And for that, you need to do a percolation test where they actually just, dig a hole basically in the drain field, fill it with water, see how long it takes to seep down, make sure it's still percolating. Making sure that the entire system is being tested versus just the tank is also important in here. As far as funding goes, fee schedules for inspections and certification of private inspectors can help fund the administration of a septic code. Another thing that we objected to in the statewide bill that when it was originally introduced was there was preemption. There was preemption in there that would have repealed all county level health codes, and also there was no funding to county health departments, but county health departments were supposed to carry out a majority of the work, including collecting the fees to be passed on to DEQ, which I know for some health directors was a little bit galling that they would be not funded to do any of it, expected to do all the work, and then expected to collect for the DEQ as well. Fee schedules can definitely help with that on the administration side of a septic code. And then funding, also needs to be provided, of course, for homeowners who can't afford to repair or replace a failing septic system. And there's actually federal money available right now that only, like I said, the 11 counties that have codes in Michigan can take advantage of, because you have to have a septic code in order to, or that requires inspection to attain the funds that are available through Part 3 of the Clean Water Act. There's also Great Lakes Restoration Initiative funding available to help with replacing failed septics, and community development block grants can be helped for senior citizens to pay for replacement of failing systems. And then another really important part to have in a septic code is, of course, a strong definition of failure. Depending on how you define the failure of a system, that really means a lot. If you define a failed system as only you can see there's a visible giant hole in the side of the tank, then nothing is going to really qualify as a failed system. So this is a really strong definition of on-site sewage system failure that we pulled, I believe, from the Ingham County Septic Code. And really the key part here, so we did a survey in Oakland County, this was about a year and a half ago now, of our members, and we found that they were supporting to have regular septic inspections every 5 to 10 years, funding for administration of the program, and to help low-income homeowners cover repair and replacement. It's a strong definition of failure, and most importantly, 84% of the respondents to our Oakland County survey supported paying an additional $3 to $10 monthly to reduce E. coli contamination in water. Now, it definitely wouldn't take that much money from every resident monthly to be able to fund a strong septic program. One of the options that we've been looking at actually for the state level bill is and the theory is basically this. I'll throw this out here for you folks. All of us who live on a sewer system pay a sewer bill monthly or quarterly or whatever it is around here. I know mine's monthly. And that goes to maintaining the system. When we did renewable energy financing in Michigan in 2008, it was a very popular program that got bipartisan support because there was on-bill financing was a key component of that. So we were able to keep the charges for moving to renewables to less than $3 a month and accounted for in everybody's bills. And the on-bill financing was really a critical part of making that work. The only reason we can't do on-bill financing for septics is that there is no bill to attach this to. But if a county could theoretically find a mechanism of collecting even just $50 annually from every owner of a septic system, you could pay for the full inspections every 10 years and also have money left over to be able to spend on doing no interest or low interest loans for low income homeowners who needed to replace failing systems. So that's sort of one of the funding options that's being thrown around, figuring out how to do it that way so that we could have the regular inspections and all that stuff. But again, this is a complicated problem, lots of different ways of doing it. And I'm just excited that y'all are interested in, working on this issue. We think it's really critical, especially as we look into the future of water here in Michigan. If we're not taking care of the problems like this, the problem of climate change and the rising water temperatures that we're going to see and the rising water amounts that we've already seen become a much larger problem when you have problems like this going on in the background. So we enjoy, we look forward to working with Oakland County and Oakland County continuing to be a leader for our environment and public health with all the great work you're doing so far. So I guess we'll open up if there's any questions at this point in time. And this is all of my contact info. Feel free to get in touch.
Thank you. It is an important issue to us. Years ago, before my time on the commission, I know this was a topic of concern. And since beginning with the commission, I've heard from many residents in Oakland County that this is a concern that's important to them. So we're gathering all the information, reviewing the history accumulated, and I am surprised by the E. coli that's found in our rivers and waters, including Oakland County, so thank you. So Commissioner Taub, followed by our health department.
Thank you. I have some questions. Kathy, how many beaches did you close over the weekend?
I'm not sure.
Okay. I don't recall any being closed in Oakland County, based on the news.
I think there are a couple. I was looking at this last night.
Okay.
There are a couple in Oakland
Okay.
County closed right now.
Yeah. Are you able to test now whether E. coli comes from?
Coming, we're almost ready.
Okay, so let me get this straight. You will be able to take a sample of E. coli and know whether it's ducks and geese and who knows what, or human, okay? How many complaints do you have annually about leaking septics? Because I'll tell you what, I have one septic in my subdivision, and I've never, we'd like to convert it to, but the person doesn't want to. But there has never been any leakage. He takes good care of it. So, you know, to me, I've smelled leaking septics, and they aren't very, they are not gardenias or roses. Can you answer that, Kath?
So, as you alluded to, there, septic systems can leak in your groundwater.
Can you speak into the,
Sorry.
one of the, yeah. It's hard for our television people
Sorry.
to hear. Yeah, make sure you're on there.
Yes. So septic systems can leak in a variety of ways. It depends if we got straight pipes or what the issue is. But a leaking septic system generally surfaces in most cases, many cases, or it backs up into the home. Nobody wants to live with that, and everybody gets those taken care of. Those that might be discharged either intentionally or unintentionally to a lake, river, or stream, that's another story, and also it's something that we generally can catch. If we start to notice something through our beach monitoring program, it has a way of trickling down to lakes where we're monitoring and should be coming up with results that would indicate that. And in those cases, we do some extensive follow-up, trying to find if there are leaking septic systems. I have to say, we have asked repeatedly. You keep saying that there's strong evidence, and Dr. Rose's study supposedly indicates that there's evidence of E. coli in our Oakland County lakes, rivers, and streams, and yet we never get anything back that would show us that. I have to question, how are those results tied back to septic systems? And how do we know they're not the result of combined sewer overflows after wet weather events? Because that's millions of gallons of sewage going out into streams after wet weather events, whereas a septic system, we're talking about a trickle, really.
And so I can answer the basics, and I think what would really be best, and I'd be more than willing to help facilitate and make this happen, but for Dr. Rose to come in and sort of give some presentations on
I
the
have repeatedly
findings.
asked for that report, and I don't know why I can't have it.
I can send it to you.
But you have said that before, and we've not received it, and we would really like to.
Okay, I'll send that over. It's but yeah, and I can also see if Dr. Rose can come in and present, if that would be useful to folks. But I know the way she determined that it was not coming from combined or separated sewer overflows was that they did the testing of these 64 rivers when the rivers were running at very low flow during a dry time of year when there hadn't been any overflows for several
And there are
days.
still issues that happen where we have pump stations that fail even during dry periods, and sewage is dumped into streams unintentionally, but it happens all the time. Whether it's dry or not doesn't mean it didn't come from a municipal system someplace upstream. You can't declare that it's from leaking. I take great exception to that. I take exception to how the state has evaluated what the failure rate is across the state. And as you know, the reason for wanting to have a statewide sewage code is because so many jurisdictions have terrible sewage sanitary codes and septic programs. Oakland County has had a gold standard program for years, which the state is constantly providing tremendous accolades about our program here. So to say we have the same failure rate just because it's found in some other county, I happen to be on an accreditation board for the state of Michigan where DEQ is evaluating other septic programs, and honestly, there are counties in this state they don't want to pass because their septic programs are so horrible. And for us all to pay this enormous price of what you're suggesting based on the fact that others have horrible failure rates, and we're not seeing any evidence of it, is a really hard pill to swallow.
We live in the Great Lakes region. We're responsible for 20% of the world's fresh water.
Correct.
I think it's up to us and all of us to do what we can. And then we still have many people living in Oakland County who report concerns regarding the septic systems.
All I can tell you is the evidence that we see, and I have evaluated evaluations done in other counties that have point of sale, and I can tell you their evaluations of a septic system are not great. So, it's not, we can't compare apples to apples here. It's really, every jurisdiction is very, very different.
Commissioner Todd?
Yeah, I also believe that we have a responsibility for clean water. That goes without saying. But sadly, you take all the septic systems in the state and you find out, and then you average it out. We're not one of those people. I've sat through so many things, so many laws that have been passed by state legislatures or state legislators as well, that, they have a problem in Benton Harbor, so they want the whole state to comply. I'm picking on Benton Harbor, okay? I can tell you that if our people are pretty astute for the most part. We don't have the farms anymore that we used to have where it goes unseen or unreported. We have people living cheek to jaw with septics. So if your septic is leaking, your next door neighbor is gonna pick up the phone and call Kathy or call the township or the village or the city, wherever, quickly, because you can smell the darn stuff. Pardon my language, being very graphic. But Oakland County has put together incredible programs, not just for septics, but in other areas, and we get tagged with the same thing that Alger County and the Upper Peninsula gets tagged with. Not fair, okay? Sadly, part of this is due to term limits, because people don't know what came before or what is there. I think we do an incredible job with what we have. Yeah, Kathy, you do catch some people. But it's not the numbers that we're looking at, I don't believe. Because the state says that there's 10% failing, whatever, that could be 50% over in Berrien County, okay, and 1% in Oakland County, but we get tagged with that 50%. And we have to start, I know that MAC is not pursuing this, the Michigan Association of Counties. They are leaving it alone. I've already asked that because I'm on their board. They feel that each county should handle it as they see fit, and if they're handling it, it ought to be done with. And I don't think the legislature is gonna pass, I don't think it's on their agenda, quite frankly. We all want clean water, that goes without saying. But I think we've brought a Mack truck to hit a fly, okay? That's just my personal
I think we're all in
opinion.
the same boat, rowing in the same water. I'd like it to be clean water, and I'd like to move forward with doing whatever influence or persuasion we can to make that happen. Commissioner Nelson?
I just to say, thank you so much for coming here today and presenting. I think we all, the one thing I do have to say first to Shelley, one of your comments is Oakland County is kind of the exception, given that we have the most inland lakes than any other county here in Michigan. So that puts us in a bigger spotlight of making sure that we are doing what we can do to protect and preserve, not just our lakes and our watershed, but literally the essential, one of the most essential things is water. And if we don't do something to protect it now, I fear that in the future, we're gonna have bigger problems and it's gonna cost us more money. When you heard, when I talk about 20% of our fresh water on our earth, on our planet, comes from here in Michigan, you would think, for God's sakes, that we would have at least a septic code.
Right.
And given that we are the only state that does not have a septic code
That's not accurate.
That is not accurate.
from the research and understanding that I have, Michigan is in fact the only state in the United States that does not have a septic code. While there are counties here in Michigan that have adapted their own form of codes, let's just say that we know for a fact here in Oakland County, we don't have anything in place to help preventing a bigger potential problem in our future. And I think that there's a hell of a lot of things that we can do presently to start making sure that we are preserving the cleanliness of our water. So I unfortunately have to excuse myself, but I definitely wanted to say thank you. And I look forward to learning more about septic codes and what we can do to find solutions that really can benefit every person and every entity that is involved, because it's a big task.
Thank you very much, Commissioner. And I'd just like to say, I mean, we're definitely not here to try to pick on Oakland County in any way. If anything,
the
we're here
opposite.
because Oakland County does things the right way.
Yeah.
And has been a leader on environmental issues. And if we're gonna get the state to move forward in a good direction here, which is necessary, we need somebody to take the first step.
Thank you, and that's what we're moving forward with. Commissioner Todd?
Yeah, I have concerns, not just for Oakland County, but for other itty-bitty counties with 5, 6, 7,000 people. They don't have the ability to do this, okay? They just simply don't. So if you're looking for a unified code, that is why I believe the state wants each county to do what they think is best. And I feel picked on, okay? I feel absolutely picked on. I hit the jackpot last year or the year before because I received more letters than any other commissioner about clean water in my district, okay? Close to, I think it was over 300. And I wrote back to every single one of the people, and I didn't disagree with them. I think we need to have clean water, and I know you initiated this campaign. I understand that. But every single one of the people who wrote live on sewers, because I know where they live. They left their return address. One didn't have return address, so we didn't answer it. So I presume everyone lives on sewers. It's real easy to point the finger out at those dumb farmers living in Oakland County. They're not dumb. And the biggest environmentalists I have found in all my years are farmers. They want to preserve their land. They don't want human waste or any other kind of waste when they have to feed us and get their living from the land. So I think we're doing a good job in Oakland County. Could we improve? Maybe, okay? But to what extent? I don't.
Commissioner Todd, I'm going to interrupt you because we invited them here for their information. We're gathering information so we can move forward to make sure we have clean water and a good
So
septic and encourage that everywhere. The rest of our board has left. So you in effect are talking to the choir here, so this might be a conversation we could have when.
So is the plan to put in
remaining board-
so the plan is to put in a septic code? Is that correct?
We have a septic code in Oakland County. The plan is to continue to move forward to influence and emphasize the clean water. But we need the rest of the board to make this happen.
Well, it's the second time today I've been cut off, but thank you, Madam Chair.
Can I respond to, I did just want to tell an anecdote that might be relevant. I did do a presentation about this issue to the North Oakland Democratic Club, and I did have 3 members of that club come up to me afterwards and say, I have a septic system and I've never gotten it inspected. I didn't know that that was a thing I was supposed to do. I get it pumped every 5 years, but I've never gotten it inspected. So I just want to say, I know that that's, a very small sample size, but in going around the county and talking to folks about this, I have seen some gaps in folks being unaware of the necessity to inspect their septic tanks. That doesn't mean that they are leaking, but it does mean that they certainly could in the future. And I don't think that we're accusing Oakland County of anything. We really we want to work with you to continue to be leaders so that we can bring this to the state and protect our water across the state.
Thank you. Thank you. So this presentation will be included in the minutes for our next meeting. Any further thank you very much.
Thank you so much for the time.
Is there any further business to come before this committee? Then without objection, I declare the meeting adjourned at 1:08. Thank you, everybody.